what an SLP does in skilled nursing, or SNFs. Number one, in SNFs, the caseload is a little different than what you'd see anywhere else. Of course, you're going to be working primarily with adults, older adults at that, and geriatric individuals. So essentially, you're really working with people primarily ages about 55 and up when you're in skilled nursing. Given this, the type of caseload or the type of treatments you're going to be providing really varies based on where you're providing coverage. If you're providing coverage and treatment in a skilled nursing facility, you're going to get quite a mix of dysphagia, dementia, cognitive linguistic goals, safety goals, and sometimes some speech and language goals, primarily that take place after a stroke, primarily working on aphasia or apraxia or dysarthria. That's usually what you're going to see. Alternatively, if you're working more in assisted living facilities, that's primarily more going to be focused on higher level skill sets because the people that you're working with tend to be higher level than what you're going to be seeing in skilled nursing. So for example, you might be working on IADL tasks. These are going to be higher level cognition tasks primarily. So maybe in collaboration with occupational therapy, you might be working on medication management, or you might be working on how to use a cell phone or how to use a computer, a laptop, how to work through to utilize a television, or memory strategies, things like that. You also may be working on voice, for example, if someone has Parkinson's. You may also be working on dysphagia, but that really depends on the diagnosis that someone may have. Alternatively, if you're floating into memory care, that's primarily going to be work with folks with dementias. And those goals usually are going to focus on either enhancing communication abilities, so usually wants, needs, thoughts, ideas, opinions, things like that, but more on the basic side of that. Or you're going to be working on functional safety, sequencing, reasoning with those individuals. So it may be as basic as being able to utilize a call light effectively, or implementing compensatory or adaptive strategies to really enhance that individual's safety. So maximizing safety while maximizing independence as much as possible. Alternatively, if you're working in independent living facilities, so these are going to be the most independent of types of skilled settings, a lot of these therapy goals are going to be more similar to those that you would see in ALFs or assisted living facilities. We'll get more into the different levels of care in a future video, but this is a general. Oftentimes, what you're going to see in independent living facilities is, again, those IADL tasks, so high-level cognition tasks, high-level memory tasks, usually focusing on compensation or adaptation, sometimes dysphagia, sometimes voice, that's going to be a common one, and sometimes you're going to be working on speech and language. Happy to continue to talk about these topics in future videos.